You are watching the Doctalk show.
Welcome back from the break. With me is a powerful team of gentlemen who are experts in pain management without the need of using medication. Yes, there are various ways you can control that pain that has been aching. Perhaps maybe your back pain, your knee pain, or any part of your body. So I want to hear from them, from the experts, to tell us exactly how they go about in controlling patients' pain without having to prescribe medication. So on my immediate right is Mr. Sebwana Charles, a practicing chiropractor. This is a field of therapy that deals with bone and muscle alignment. And on his right is Mr. Solomon Kayondo, a practicing physiotherapist from Kampala Hospital, and of course Mr. Sina Ismail from Activate Body Therapy Center, who was with us in the earlier segment. So you're most welcome to the show, gentlemen.
Thank you.
Yes, so today's topic focuses on pain relief, and as you listened in the previous just before we went for the break, Miss Jolie had the problem of chronic pain in her knee as a result of excessive physical activity, probably resulting from uncontrolled forces exerted on the joints. So I want to understand, maybe we'll first start with understanding what exactly they do and how it relates to controlling pain management. So Mr. Charles, for example, I'll start with you. Yeah. In this field of chiropractic, maybe you could help the people understand what exactly is it? What is a chiropractor? What is chiropractic?
Chiropractic is a healthcare profession concerned with the diagnosing and treatment of neuromusculoskeletal disorders. I'll simplify that. Neuro to do with the nerves, muscles. Earlier in the program, somebody was talking a lot about muscles, and skeletal is to do with the bones. So, chiropractic specialize in managing conditions in that category. Okay. And we use conservative means to handle those problems, symptoms related to that problems, including pain.
Okay, so excellent. And so, Mr. Kayondo, you are a physiotherapist. Yes. I know, people might be familiar with physiotherapy, but they may not really understand what it means. What does physiotherapy mean? They know the term, but they do not know what it means.
Physiotherapy is basically the assessment, treatment, and diagnosis and treatment of physical disorders using mechanical means or physical means. And by mechanical means, we can use exercises, the other means which include like electrotherapy. Those fall under all physical, not using medicine, but physical means to treat pain.
So kind of physical maneuvers to exercise the muscles and the joints. Yeah. All right. So to start off this discussion, we are talking about pains that tend to disturb patients. They take lots of medications and nothing seems to be working. These are the chronic pains. For example, the sports injury, you got that injury in the gym. As Miss Jolie explained, she had pain for 4 months, taken lots of painkillers, nothing is happening. Or Mr. Sebwana, in your clinic, you might see patients who are complaining of severe back pain. They are swallowing lots of medicines, nothing really is happening. So I want to understand what exactly is pain. Why do people experience pain?
Pain in simple terms is one of the symptoms coming from body ailments. There are other symptoms, but pain is one of them. And is experienced as pain as we know it. We can't define it more, but pain is pain. It disturbs. When you have pain, you are very uncomfortable, you can't do anything, and sometimes the condition is so bad that you cannot do anything, and you are in agony, you are suffering, and that's pain. And it brings a lot of misery to the people, and that's why we are here to try to tell the public what pain is all about and what we can do to help at least people overcome pain.
Okay. So when you talk about, well, I know there are different types of pain. There's what they call the chronic pain. What does that mean exactly?
Usually, when there is a pain as a symptom, it starts in form of acute when it's new, when it's still very painful. But later on, when the body has managed to silence it a bit, it becomes chronic. And if it's not handled, it continues disturbing the person, and it can even lead to disability.
So, Dr. Sina,
Yes.
Regarding chronic pain, why do people get such pains?
So the reason why people get chronic pain is because obviously it goes through an acute phase where people ignore. It's always, when I'm dealing with clients, I always say, every time you get acute pain, deal with it immediately. If you don't, then it goes into chronic pain.
Becomes chronic.
Yes,
So it always starts with acute,
yeah,
then it goes to chronic.
And most people, they've got this, because they don't know where to go, they always think, okay, I'm going to live with the pain. And some people associate that with age, which I completely disagree. So pain has to be managed. As Dr. Sabwana said, we have to manage the pain. And pain is a signal to your body, something's not right. It's like you having your car and the dashboard lights, and it shows that the brakes are not working. So you fix the brake. So with pain, once you get acute phase, please fix it.
Okay, all right. Mr. Solomon, so in your practice as a physiotherapist, are there particular conditions that you see people coming to you regarding pain? Which are the common conditions that you see that you as a physiotherapist you've had to work on to try and relieve the pain?
As a physiotherapist, I deal mostly with physical. Like my main concern with the patient or client is how they walk. So pain might be caused by movement. Like if someone has osteoarthritis, they can't move very well. So they're having pain because there is something in their bones, but they can't move their muscles that well. So they'll get chronic pain. So they will not work or not do things they are supposed to do because of pain. So you see a lot of chronic pains in arthritis. This is a medical condition which translates into a physical manifestation. Then back pains. You get neck pains, a lot of neck pains, and other sports-related pains, which is due to an injury.
Okay,
Yeah.
all right. Yeah, and just so I know we're talking more about physical pain, but there are also other types of pain. For example, psychological pain resulting from either a stressful event or a loss of a loved one, or that can cause the type of pain which may not be a physical manifestation as a joint pain, but you feel pain in your mental well-being. So there's what they call psychological pain, as well as spiritual pain, pain to do with your spiritual sense. What gives spirituality, we usually define it as what brings meaning to your life. So if you have lost that sense of meaning in your life, you have lost all hope for living, we call that spiritual pain. So there are different types of pain, but particularly I want to discuss physical pain and chronic pain. So after the break, we'll come back to understand more about how these specialists manage chronic pains of their clients. You have had there are different types of therapies, chiropractics, there are the physiotherapists, the sports therapists. So I want to understand exactly how each of them addresses the issue of controlling pain. Don't go away, we'll be right back after the break.
You are watching the Doctalk Show.